I wanted to start by asking you about what you're seeing on a day-to-day basis. And basically, what are patients saying to you when they talk about their sleep or their quality of sleep?
Thanks for having me. Here at the center, one of the most common issues that we hear patient experience is lack of sleep. And it could be either falling asleep or staying asleep. But it becomes a very frustrating issue for them because it's not always easy for people to get to the root cause of why it's happening.
Yeah, one of the things that I think you need to bring up when you're talking about lack of sleep is how illness impacts that too, because there is a lot of people that are going to have sleepless nights. And I think that's something you have to kind of push apart and differentiate from people that actually aren't able to sleep and are diseased. So what are some of the things that happen to us physiologically when we're fighting infections or fighting off disease?
I would say a really nice way to kind of look at this is the traditional Chinese medicine model. It does a good job at explaining how it embraces our body clock and how each organ corresponds to a specific or its these particular times of day are utilized to maintain wellness of a patient or fighting the active disease process. So interestingly enough, when a patient is here going through any sort of treatment, the typical hours that you're sleeping are when the major organs like large intestines, liver, gallbladder, and the lungs are at their strongest point. So on a physiological level, these organs play a major role in ridding the body of infection. So sleep disruption is very possible because all of the energy is going more so to there rather than the areas that provide quality sleep for a patient.
Now, when you recommend things to patients, where do you start? Where do you even start to look? What are the questions you're asking the patients who are saying, Nicole, I'm just having terrible sleep. What can I do?
The first question I usually ask, unless there's some obvious, physical reason for it, is their stress levels. I think that more often than not, a reason someone can't sleep has something to do with their stress or emotional status. So that's a big one I ask them. Another one I'll ask is what their sleep environment looks like or what they're doing that hour or two before bed, because this is a really critical time as well for that wind down process and really leaving that flight or fight phase we're staying in most of the day and more of a restful phase. And lastly, sometimes I just simply ask them what they think the reason is that they're not sleeping. Oftentimes a patient might know what the root cause might be or what the issue is, but they don't know how to get there. So that's where we come in and can give them helpful tools and to move forward.
I really like that question because I feel like so many times people know the answer. They just kind of throw it out there and want confirmation from someone who's a professional. But if we use that intuition, we usually get what it is. We usually know we're stressing. We usually know we drank too much caffeine during the day. We usually know, hey, I left the TV on as I'm trying to go to sleep and that screwed it up.